Hello and welcome everyone. Namaste. Welcome you all for day 4. 3 दिन निकल गए, आज का चौथा दिन है. Now where we will explore and expand our limits and push further. है ना, आपने थोड़ा सा ये लिमिट को और थोड़ा स्ट्रेच करके we will do this exercise. So can you type in the chat, let me know that how many days from last 3 days, कितने दिन आपने join किया है? Like you can, if you have joined all 3 days, then you can type 3. If you have joined 2 days, then you can type 2. If you have joined today only, you can type 1. Oh, so many of you are joining. You're saying 3. Great, great, nice. So many of you are saying today is a day 4 and you are also joining for the 4th time. Great. Yeah, if you are struggling with the audio issue, you can shift to the YouTube link. अगर आपको सुनाई नहीं दे पा रहा है तो आप YouTube पे शिफ्ट हो जाइए. It will help you out. Great, great. Yeah. And how you are feeling with by doing these exercises? आप कैसे महसूस कर रहे हैं? Can you just type in the chat and let me know how you are feeling after doing these exercises? You know, it is not required so much time for doing it, right? And so effective and precise. So many of you saying good, easy. Today also you need that towel roll. आज भी आपको towel roll लगेगा और pillow और cushion. Can we get the recording? Yes, you will get the recording after the session. Uh, Good. So let me welcome our guest, Ojas sir. Yeah, Ojas sir is already ready with the towel roll. You can also, bring from around. Yeah. Hello, sir. Good morning.
Hello, good morning. Namaste, everyone. I hope all of you are fine. So, I think the basic things needed today will be a towel roll, a simple towel roll like this, or else you can take a pillow, as rightly said by Kanchan. And we need an exercise mat so that we can sit comfortably on the floor. If in any case you are using a mattress to sit, then it is advisable to keep the mattress very thin. It should be a 2.5-inch thick mattress, not more than that. But it is advisable to sit on floor. So let's begin with the Also, I would like to say that if you do 10 minutes of hot pack every day before the session starts, then it will be very helpful because it is in itself a kind of warm up to the knee. So just 10 minutes of hot pack in the knee area, just wrap the knee around, and this will be very helpful pre-exercise. So let's start for the day. I'll first repeat the exercises for yesterday, and then we'll go with the day these exercises There is not much change in the exercises, but I'll be introducing certain variations in the exercises, and also we will increase the holding time of the exercises. So let's start. Attain a comfortable posture in a long sitting position. We will start with the warm-ups first. You can also do this in a lying position, as I said earlier. So we will start with the ankle pumps. So I'll hope that you will be doing these exercises with me. So let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So these were ankle pumps. We will now move to ankle rotations. 1, 2, 3, 4, 5, and 5 times clockwise. 1, 2, 3, 4, and 5. So we are done with ankle rotations. As discussed earlier, ankle mobility and hip mobility are very important for knee mobility to be there. Now we will do knee mobility exercises. So bend one knee at a time, one, then the other, two, three, four, five, six, seven, eight, nine, and 10. So these were knee range of motion exercises. Now we will do knee rotations. To make it more visible, I am using this position. Bring your knees together. Your legs should be straight, slightly bent at the knee, and then rotate clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So I hope you are doing along with me. Now we will do these knee rotations in anti-clockwise manner, that is towards your left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We are done with knee mobility. Now we will shift to hip mobility. Attain a lying position and be comfortable. So both the knees bent, दोनों घुटने मुड़े रहेंगे, and one hip at a time. Bring it closer to your stomach, the leg up, and this motion at the foot level. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Repeat the same thing on the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. While doing this exercise, you will notice that as you do the ankle pumps here, gradually you will see that you can bring your leg upwards, more upwards. So it should be a natural progression. You should not force it, but eventually it will happen. Now we have to sit up again. Here a word of caution is there. अगर आपको लेट करके बैठना है तो it is advisable पहले आप करवट लें, उसके बाद आप बैठें. डायरेक्टली आपको सेटअप नहीं करना है. Especially for people with back pain, it is very much advisable to first take a side lying position and then sit up. Now we will proceed with the day 4 exercises. That is exercises for today. We will be doing isometric exercises. So this towel roll or a pillow will be required. This can be done in 2 positions, in full lying positions or in a long sitting position. I'll be doing it in a long sitting position. So you will be doing along with me. We will do certain number of repetitions of each exercise. I am placing the towel roll under my right knee, and we will begin with the quadriceps isometric exercises. So place this under your knee. I'm using my right knee. Now let's begin. One, two, three. So I am pressing the towel roll or pillow with my knee. The effort is at this level, the front part of your knee. Four, five, six, seven, eight, nine, and 10. Relax your knee. Relax for a period of 4 to 5 seconds, and then we will do it again. One, two, three, four, five, six, seven, 8, 9, and 10. So you see that when I'm pressing the towel roll, this leg is not touching the surface area. It is slightly above the ground level. So this should happen when you are pressing it. That means you are doing it correctly. Now we will go on with the other repetition. One, two, three, four, five, six, seven, 8, 9, and 10. Now I am switching the towel roll to the left side. To make it visible to you, I am removing this right leg towards the side. Place it under your left knee. Be comfortable, spine erect, and press it down. Count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax, take a break. It can be around 4 to 5 seconds. Take time to adjust and repeat it again. One, two, three, four, five, six, seven, 8, 9, and 10. If it is not possible for you to count it verbally, you can place a timer along with you. You can use a stopwatch in your mobile phones, but it is best advisable that you count it verbally so as to not get distracted. Repeating it again, press it down. One, two, three, four, five, six, seven, 8, 9, 10. So this is quadriceps isometric exercises. This helps in strengthening the front part of your knee or front part of your thigh. It provides anterior-posterior stability to the knee. So it is very helpful in cases of people with arthritis at the knee or people with meniscus injury, ligament injury. This is very helpful. Now we will proceed to heel pressing exercises, that is placing the towel roll under your heel. So I'll begin with the right side. Again, a long sitting position or a full lying position. You can just place your heel over the towel roll or pillow and press it downwards. Again, the foot can be relaxed, pointing forwards, or it can be perpendicular to the prop. Anyways, which is comfortable. Now I am pressing it down, and the effort is here beneath the knee. So you should feel some stretching or some contraction beneath the knee in the backside, and I am pressing it down, counting. One, two, three, four, five, six, seven, 8, 9, 10. एक्सरसाइज करते वक्त मैं आपकी तरफ देख रहा हूँ, लेकिन आपके लिए ज़रूरी है कि आप सिर्फ एक्सरसाइज एरिया पे देखें. अगर घुटने पे टारगेट हो रहा है तो घुटने की तरफ देखें. अगर हील पे आप कर रहे हैं तो वहीं पे देखें, बिकॉज विजुअल फीडबैक इज वेरी इंपॉर्टेंट फॉर द ब्रेन टू रजिस्टर द एक्सरसाइज. So if you are looking at the area which you are targeting, it will give you more enhancement in muscular strength and muscular control. So repeating the exercise again, press it down. One, two, three, four, five, six, seven, 8, 9, and 10. You can take a break, relax the knee. The relaxation periods are more frequently required in people who are having severe knee pain or acute knee pain. And if you are suffering from arthritis, you need to take frequent breaks in between. Let's do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So just like I used my hands for the spine support, you can also do. If you find it impossible to keep your spine straight, this this action helps keeping the spine straight. It also unloads the spine while you are seated in a long sitting position. Now we can change the side and place the pillow or towel roll on the left side under your left heel. Now we'll do the same exercise again, pressing it down and counting 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax your knee, give it a break, and we'll do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I hope that all of you are doing these exercises along with me. If there are any queries, you can definitely ask, but keep doing them. It's very important to make a habit of these exercises, and that's why we are organizing the 7 days challenge so that it becomes habitual and a daily routine for you. So, doing it again, press the heel down and count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Right? So these were heel isometrics or heel pressing exercises. These target the hamstring muscles. So the hamstring muscles are here in the back part of your knee. These also provide anteroposterior stability to the knee, helpful for people with ligament injuries, meniscus injuries, and arthritis of the knee. Also, this is a right foundation exercise, the quadriceps and heel press exercises. These are the right foundation exercises for increasing your muscle strength. Now we will move to adductor isometrics, or the one which we did yesterday, that is placing the towel roll or pillow between both your knees like this, and then we press this and hold it for a period of 10 seconds. Again, I am repeating, people with high blood pressure, they need to hold it for a period of 3 to 4 seconds, not more than that. They can take breaks in between. They can increase the number of repetitions, but the holding time will be decreased to 3 to 4 seconds. So what I will do is I will demonstrate the exercises separately for people with high blood pressure and for normal population. So for starting for normal population, I am demonstrating this. So the variation today is that we will be doing this in a long sitting position. कल हमने इसको नी बेंट पोजीशन में किया था एंड देन बीच में हमने टॉवल रोल या पिलो रखा था. आज हम इसको लॉन्ग सिटिंग में करेंगे. टांगे सीधी रहेंगी, घुटना सीधा रहेगा एंड बीच में टॉवल रोल रहेगा. यू कैन प्लेस इट लाइक दिस. I hope it is visible, and I'm pressing the towel roll with both my knees together, and here I count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If it is not much visible, I can do it like this. But आपको लॉन्ग सिटिंग में करना है, घुटने सीधे रहेंगे, टॉवल रोल को प्रेस करना है फ्रॉम बोथ द नीज टुगेदर. काउंट 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. For people with high blood pressure, this can be done like this. Holding the prop from both the knees together and pressing it, counting 1, 2, 3, 4. That's it. You can repeat this again after a short break. Again, pressing it. Start 1, 2, 3, 4, and that's it. Making it more visible. Place the prop in between, press it from both the knees together. So your ankles or feet will be at 90 degrees if the effort is being done rightly. Press the towel roll or pillow and start counting. One, two, three, four, and that's it. So we have done till now the ankle mobility, knee mobility, hip mobility, which essentially work as warm-up exercises and basic exercises for further knee strengthening. Then we did quadriceps exercises in which we placed the pillow or towel roll under our knees and pressed it and holded it for a period of 10 seconds and 3 to 4 seconds for people with high blood pressure. Then we moved forward to heel presses, in which we placed the prop under our heel and pressed the prop with the heel downwards and holded it. Then we moved on to adductor isometrics. By adductor isometrics, I mean the inner side muscles of your thigh. They are called adductors. So we use them and strengthen them by pressing the prop in between. We pressed it like this and holded it. So it was a strengthening exercise for adductors. They provide mediolateral or side to side stability of the knee. So if you see me, these are my knees. So there are two kinds of stability. One is a front to back stability and one is a side to side stability. So adductor isometrics help in side to side stability of the knee. These are very important for people with ligament injuries, right? So now we will include a certain variation in the exercises, and that is we will do straight leg raising in long sitting position. So what it means is just see my leg. I am raising it in a long sitting position, right? You can do it in a lying position as well. So keep your foot towards yourself and raise the leg. This much of leg raising is sufficient. It will not go beyond that. And I'm holding it for a period of 5 seconds. So I'm counting 1, 2, 3, 4, and 5. Now relax this leg. Doing the same thing in the left leg. 1, 2, 3, 4, and 5. So when I lifted the left leg, my left ankle was towards me and the right ankle was forwardly directed. So this helps in increasing the muscle strength of the left leg. Similarly, if I lift the right leg, my ankle is towards myself, the right ankle, and my left ankle, it is pointed forwards. So this alteration in movement, this helps in increasing the strength of the target leg, right? So we are done with the exercises for today, and I'm open to queries. If there are any, please let me know.
Yes. So thank you so much for just for wonderful explanation of today's exercises. There are a few questions. I'm not able to sit down because of my knee surgery and make my legs straight. So what should I do?
So it's okay. It's not necessary to sit down on floor if you had a knee surgery or any severe knee condition. In that case, you can sit on your bed or mattress, but make sure that you place a pillow beneath your buttock area so that it is a normal plane. Because if you sit directly on a mattress, then you will put unnecessary stress on tissues. So just place a pillow beneath your buttock area and do it on your bed.
Yeah, can I do this exercise by using the knee braces?
You can do that, but it is advisable to remove the braces and then do the exercises, because if you wear a brace at the knee and then do the exercises, then it limits the movement. The function of a brace is to limit the knee movement to some extent. So your knee mobility will be impacted if you do it wearing a brace. So advisable thing is that you remove the brace and then do it.
how much pressure we should put while doing the exercises on the leg?
So it is required that you put a comfortable pressure, place a comfortable pressure. It should not be very much, too much. It should just feel comfortable and convenient to you. We cannot quantify it because it is not a quantifiable thing. So it is just a subjective experience. The idea is to keep it moderate, not too low and not too severe, just moderation.
I have early arthritis, so I'm not able to do the daily routine of exercises. Which of these exercises can help me for stiffness in the legs? I'm suffering with it now.
So for a correct recommendation of exercises, you will require to get an assessment done. So after an assessment only, I can suggest you the right recommendation of exercises. But in general, you can do all these exercises. These are not harmful for arthritis. These are always beneficial for arthritis.
Cracking sound in the knee, is it something to worry or it's normal?
See, there are two kinds of sounds in the knee. If there is some kind of clicking sound which happens when you get up after long sitting or while you are doing knee warm-up exercises, they are normal if they are not very much frequent. Then there are grinding sounds. It feels like there are certain broken pieces inside the knee. They can be a sign of arthritis. So that is troublesome, and then you can go for go for an assessment with a physiotherapist or an orthopedic surgeon.
I am feeling uncomfortable sitting on the ground. Can I do this on the bed?
Yes, as answered earlier, you can do this on a bed. Just place a pillow beneath your buttock area.
Yeah, that's it from our end. Any suggestion or the homework for the people?
Yeah, suggestion is if you are doing it on your bed, then you can also place a thin pillow or a thin roll beneath your knees. So the idea is the mattress is habitual of getting compressed downwards. So if you place a pillow under your buttock area and under your knees, then it will be a normal plane. Your whole leg will be in a normal plane. So that's the whole idea. Keep it level grounded. That's it. And yes, as discussed earlier, if you do 10 minutes of hot pack pre-session every day, then it will be helpful because it will be kind of a warm-up exercise for the circulation around the knee. So if you do the hot pack and then do warm-up exercises and then do the strengthening, it will be very impactful.
Yeah. And should they practice all the 4 day exercises or day four only?
Yes, you should practice all the four exercises till now. It is advisable that do the bridging exercise every alternate day and not daily. If you are not able to recognize bridging exercise, then you can see the recording of previous day exercises, particularly day one and day two. So it is required to do bridging on alternate days. The rest of the exercises you can do it every day. I am hoping that you practice this every day. The more you practice, the more you will be getting habitual of the exercises, and the more you will reap the benefits of these exercises.
Okay, there are a few more questions which came now.
Sure.
It's like, mm, how many times in a day or how many repetitions I should do daily? This is kind of the common question what people are asking.
Mhm. So it can go up to 3 to 4 times a day. And for each exercise, it is recommended to start with 10 number of repetitions. And there is no fixed number for number of times in a day. It number one is your comfort level. Number two is how much disciplined you are, how much time you can afford from your daily life. But it is advisable to do it 1 to 3 times a day. Start with once a day and gradually build it up. So weekly you can progress. For week 1, take it once a day. Week 2, do it twice a day. And week 3, you can do thrice a day. This way you can progress. So slow and steady wins the race.
जिनका पेट बाहर निकला हुआ है वो सीधे नहीं बैठ सकते हैं, तो
हाँ।
कैसे करें?
तो मैंने आपको एक्सरसाइज आज के सेशन के टाइम बताया था कि आप अपने हैंड्स को यूज कर सकते हैं, नीचे फ्लोर की तरफ प्रेशर लगाएं, तो उससे आपकी स्पाइन को, ट्रंक एरिया को सपोर्ट मिलेगा। उससे आपके लिए इजियर होगा अपने स्पाइन को स्ट्रेट रखना।
Meniscus tear can be healed by these exercises.
सो इट डिपेंड्स ऑन द ग्रेडिंग ऑफ टीयर। अगर वो इनिशियल ग्रेड्स हैं तो यस, रेस्ट एंड एक्सरसाइजेस कैन बी हेल्पफुल इन रिकवरी। उसमें दो ही फैक्टर्स होते हैं, नंबर 1 इज रेस्ट, नंबर 2 इज एक्सरसाइजेस। सो द रेस्ट फॉर नी इज नॉट पुटिंग वेट ऑन द नी, दैट इज not walking, not standing, or else if you are walking or standing, use a knee brace while doing that activity. And exercises, isometric exercises are good in that case. So we did isometric exercises yesterday and today as well. These exercises can be helpful, but if the grade of injury is severe, then a surgical correction might be needed.
So many people are asking, can I take back support while doing exercises? Yes, you should take back support if you feel like, you know. If you are doing with one leg, can we fold the other leg or it should be stretched
Sorry,
long?
can you please repeat that?
If we are if you are doing with one leg, we are doing exercise with one leg, then
Hmm.
should we fold the another leg or it should be straight?
If possible, you can fold the other leg because it will be more effective. Otherwise, you can keep the other leg straight, but it will be more effective if you fold the other leg.
Um, um, so is the sequence necessary for doing these exercises, or we can choose the random exercises for relaxation?
No, the sequence is important. So ideally, the first exercise should be a warm-up exercise as we do every day. Then we should progress to isometric exercises, and then we should progress to other dynamic exercises, which we'll be doing in coming days.
Yeah, will this help for the back pain relief also?
To some extent, yes, but not directly. If the cause of back pain is directly coming from the back area, then it may not be helpful very much. But if the back pain is linked to joints in the lower side of the body, that is lower limbs, then it might be helpful.
I have knee inflammation and the fluid. What exercises do I need to do?
Sorry, please repeat that.
I have knee inflammation and fluid in the knee.
Okay. Okay. So in that case, it is required that you do ice packs every day. It can be done 3 to 4 times in a day. Each session should be around 10 minutes in the area where there is swelling, and keep the leg area elevated or knee elevated using a pillow beneath the knee, especially when you are taking rest. And it is advisable to take ample rest at that time until the swelling or inflammation subsides. You can also take help of oral anti-inflammatory agents as recommended by your doctor. And when this subsides, this may subside maybe in 3 to 4 days, or it may take longer. After it subsides, you can start with the exercises. But until it subsides, you can only do ankle pump exercises, which will help in reducing the swelling part.
Yeah, so I think we are done with the questions. For the people who are having the long sitting job, and because of that, they have to put leg in certain position. So, which exercise they should do for relaxation at their job positions or at the office work?
So one is when you are seated. Let me demonstrate that. So let's say you are seated on a chair. First of all, you can take frequent breaks in between, standing breaks or walking breaks. It can be done on an hourly basis. Secondly, you can release your knee pressure by extending your knee like this. You can extend it, hold it for a period of 10 seconds, and then bend it again. Similarly, you can extend the other knee, hold it for a period of 10 seconds, and bend it again. Or else you can repeat the extensions without holding, just extending one leg, bending it down, extending the other leg, bending it down. This can provide a good relaxation to the knee area.
Yeah, thank you so much, Ojas, for wonderful session. Yeah,
My
and
pleasure.
all of you will get the recording of the session. Not to worry about it, and keep doing this and see the change for yourself. Along with the recording, you can also follow it and try doing it 1 or 2 times at your place as per your comfort. Yeah, and take precaution for that. So as sir suggested, we can have the hot packs which we can use before the session. 10 minutes for the 10 minutes of hot pack will help. So see you tomorrow for the next wonderful session with Ojas sir. Until that time, you can join the yoga with Sarabhya now and see you there in that session. Yeah.
So
Thank
I
you
would
so much.
like to
Thank you.
add something. Sorry
Yes,
to
sir. Just,
interrupt. So,
yeah.
if someone develops muscle soreness after these exercises, or there is you see discomfort or pain after these exercises, in such cases you can use cold packs for 10 minutes, and this can be done multiple times in a day, so that you be relieved of that pain or discomfort. Or else, if required, you may take a day break if the muscle soreness is there. And for people with whom are experiencing the back pain after these exercises, if at all it is triggered, then it is required that you lie down on your stomach and keep in that position for some time, for few seconds. That will provide adequate rest to the back area, as sometimes it may happen if you are not habitual of exercises, right? And if in case you need any help, you can always reach out to me.
Yeah. Great. Thank you. Thank you so much for your time. And see you tomorrow, everyone. We
See
can join the yoga session now and enjoy the yoga with Saurabh. Okay. Bye bye, everyone. Thank you so much for joining. You will get the recording and the PDF of today's class. Hmm? Yeah. Bye.
Bye. Namaste, everyone.